all that remains is to see about AI. I will be talking in English out of courtesy to our visitors who have come outside Greece, and going to describe what we always wanted to know about AI, and specifically the 4 pillars of AI transformation. 2 years ago, we witnessed a few months of relentless progress. Every few days, we saw a new AI model being released, better than the previous one, and all of them doing things that were amazing. This led to an exceedingly very fast adoption of AI. As you can see here, it took just 2 months for ChatGPT to reach 100 million users, when previously extremely addictive technologies, think of TikTok, took much more time, 9 months and 2.5 years for Instagram. And this has led to a huge cycle of increasing expectations and even hype and bust. Today, we witnessed billions, hundreds of billions of dollars, more than the Greek national debt, being wiped out of NVIDIA's stock value when it emerged that a Chinese organization released a new AI model, comparable quality to existing ones, for a very small fraction of what up to now we were spending to develop such models. So what I'm going to describe is the trends of AI, how it affects healthcare transformation, and talk a bit about, as we discussed earlier, risks and outlook. Starting with trends, what is happening? Why are all those things changing? Behind this is Gordon Moore, who gave the famous law that the number of transistors on a chip doubles every 18 months, and I've been seeing that for decades happening. This has allowed us to create models of our brain in silicon. This has brought us to a position where we can have AI take over the role of software with ever-increasing capable models with many more parameters that we can use to train them, increasing ability to train such models, and increasing ability to have those data included into models, and as a result, ever more capable models, as you can see here. The repercussions of all these changes are amazing in the way we work, in the way businesses work, in the way we educate our students in research, society, humankind. I try to embark on a journey to see how all this fits together. So what do we want to know about AI, what many were afraid to ask? What is AI? It's the ability to do things that we previously thought the human brain could do, but through a computer. Split into 2 big sections. One is symbolic approaches that are used to be the case for many decades, and newer based approaches called machine learning, which are based on numbers rather than symbolic reasoning with logic. And this is what has brought us the great progress that we are seeing. They work through various buzzwords that you can see here. They don't concern us now. But the idea is that this has brought the ability to discuss with machines in the way we discuss with humans. If we ask ChatGPT, outline EHDS in one short paragraph, it will explain us what it thinks that European health data space is, and indeed it gets it mostly correct. How does it do this, and where does it fit in all this? If we see the whole AI, and one part of it is machine learning. A part of machine learning is called deep learning, based on training models, based on ever-increasing amounts of data. Some part of those are called transformers, and one application of transformers is ChatGPT and similar engines that we are seeing. How does it work? Essentially by modeling the way our brain works, constructing a very difficult and sophisticated way of connecting elements similar to model how neurons are connected, with billions of parameters that describe the weights behind those models. The main thing that I want us to remember is that it is very important because now we can discuss with it using human tongue. And this is what has made it accessible to all of us, health professionals, patients, and researchers. Here you see an outline of how these models are used throughout the world, published in the Harvard Business Review. You can see things from content creation, technical assistance, to personal and professional support, to hobbies, research analysis, and decision-making. 100 different tasks. How is it affecting our businesses, our healthcare? Based on a model that we developed for digital transformation, we can see that the equivalent in AI health transformation includes AI-enhanced patient experience, AI in diagnostic and in diagnosis and treatment, AI-enabled health, and also an AI health organization. Let me go through this. What do we mean by AI-enhanced health experience? We mean better comprehension of the patient needs and behavior. Think of predictive analytics, triaging, sentiment analysis, upgrading the patient's experience through personalization and predictive services, and also the automation of diagnosis and the treatment, as we heard before, chatbots, virtual assistants, trend prediction. Moving on to process improvements within the healthcare delivery organizations, we can automate routine tasks, data entry, invoice processing, hopefully turning back what health professionals often complain, medical doctors complain, that have to fill forms rather than doing consulting with their patients. Predictive maintenance of the systems, delivery optimization, human resource management, and also risk management. Here is an example. I can have a list of numbers. I can ask ChatGPT to format them correctly, and it gives me the numbers correctly formatted, and also a note where there might be changes that are not necessarily correct. Enhance productivity from data analysis to communication assistance to collaboration assistance and so on. Let me give you an example in health prediction. I have a bill that I've received over email. I'm asking if whether it is correct or fraudulent, and it tells me it is likely to be fraudulent for these 6 reasons: no reply address, unusual branding, and so on. It can help us in learning. Say I want to learn more about the EHDS, how to understand it, and it gives me a 4-week plan on what to do each week with topics to learn, resources, and activities. For me, it has become a personal tutor I could never have. Moving on to AI-enabled health delivery models, we have enhanced health products, health services, and life science research, as we heard before, and we will hear also later on. Finally, the AI organization, how we can have health organizations adopt AI. We need to think about strategy, operations, alignment, compliance, very important in the health sector, investments, organizational structure, and also the human resources that we are going to deliver on these things. Let me finish with risks and the outlook. As I use ever more AI, I often think I'm walking on a minefield. Here's an example from health, and you may have seen this. Researchers asked Google's model, how many rocks should I eat every day? And it says, according to Berkeley geologists, you should be eating at least 1 small rock each day. This is health advice from you, from AI. Have you eaten rocks today? And there are other things. Here is a professional, a photograph that was changed by AI, unknown to her, to add small things that should not appear on a photograph to make her look more sexy without her wanting to do that. Brings great inequity, as we heard before, from those who have access to such models and to those that haven't. And this makes me fear whether we are going to lose everything, whether with AI-enabled weapons we are going to destroy the Earth, as we have tried to do many times before, from the Industrial Revolution, cooking our planet and bringing through climate change perhaps the catastrophe, to other dangers. My view is to try to think of AI in the view of Prometheus, who brought the fire to people, brought us great advantages in the way we work and the way societies work, but also great dangers, as we saw recently in Los Angeles. And we saw it also in other cases. Always technology is at odds with progress. We saw with Icarus, who allowed him to fly, but also brought him down. For me, I try to view AI, and I hope we can view AI in a better way. Consider this prompt. I ask AI to generate a video of somebody flying. So I try to think of AI positively as something that can deliver us ever more advantages, and these are worth it despite the dangers. So these are the 4 pillars of how we can use AI to transform our health systems. And with that, I'll thank you. I look forward to the discussion we will have.